Safar. Safar. But first of all, remember what is the instrument without necessarily the name. So it is a, what is it?
It's an airway tube.
Airway. This is the name. Oropharyngeal airway. Don't use the term pipe, even though in Romanian you say pipa, so pipe. But pipe, that pipe is not airway, and that's it. And oropharyngeal.
All these tubes are
ويت بلاك وانا
كل هذول تيوب؟ لا فيديو.
Safar. Almost like in Africa, but without the eye. Safar, not safari.
بس المشكلة الفيديو هذا 100 ساعة بيخلص الميموري بيخلص.
With tigers, there is no tigers.
They're not tigers.
Maybe lions, giraffes, or something else. So, what is this?
Syringe.
Syringe. What kind of syringe? Single-use disposable syringe. It's a plastic. What is this?
This is
What tube was it? All of them are
airway tube.
endotracheal tube.
this is an endotracheal tube.
Okay.
Where's the balloon?
What?
Does it have a balloon? Oh yeah.
It does.
Yeah,
Two
yeah.
balloons.
Yeah.
كيف هالبالون انت؟
What is
نموت
this?
عليهم. Nasogastric tube.
Nasogastric tube.
Zonda.
زوندا.
We can say zonda. Or
Sonda, maybe sonda.
sonda.
What is this?
For the gastric.
It's
For the
also
stomach.
Also an endotracheal bronchial tube.
حلو.
Or a
Like you
tube
go for
used
two
for
lungs?
selective endotracheal bronchial intubation.
Well, how can you be?
Weren't you present when I have discussed the first
No.
time this? Why?
I don't know. I've been absent only for 5 classes. I have no idea how.
Only for 5 classes, that means more than a week.
more for the exam, so.
5 it's too much.
Even students never learn even from previous generation. I don't know why. What is this?
This is.
Yes, but it is a spring reinforced or spring reinforced, not spring loaded. Spring reinforced endotracheal tube. Remember, it has that spring that prevents
بعمل فيديو.
collapse when bent. Or while bent. Then,
لا التيوب صعبات مش
What
هذول
is
يعني شو ما جاك كلام بتقول.
That's a-
or chest tube.
Okay, chest tube. Chest tube. Yeah.
What is this?
افتح حنفية يا باشا.
He said it's
It is
for gardening.
that's for gardening. Okay, it is a rectal tube.
ركتب.
Okay.
Enema tube, if you want.
Animal. Okay.
Or gas tube, if you want. Because I told you, sometimes, even though I don't like this procedure, when the patient has a prolonged post-operative ileus and it is bloated at the same time,
So for training gases?
yes, the drainage gets to create, let's say, a continuous communication between the rectum and exterior. But why I don't agree with this? Because it increases the spasm of the anal sphincter apparatus around the tube. So I don't like it. Either if you insert it, you just let it, like maybe it is better to perform a enema and that's it and withdraw it. Don't let it for hours. The same thing, I told you, don't mistaken it with Nelaton urinary catheter. Because
This
it's
is a
much
urinary
bigger.
catheter?
And I remember that I had a remark when I presented it first concerning some ethnical group, etc. But it doesn't work even for those guys. It is too large.
What
Under
is
normal
it?
circumstances, maybe there are exceptions.
What is it?
Also, there is a rectal tube.
هذاك
And I told you,
ركتب.
don't mistaken it with the Nelaton. Where's
يا
Nelaton?
حرام البيش انت هذا الفيديو هون. خبيت.
لا طلع شو اسمه ركتب.
You see? Because it has the same or rather similar hub, if you want. It may be mistaken, but there is a
Makes
considerable
sense, yeah.
difference in size. This is a Nelator urinary catheter, and this is a rectal tube, or an enema tube, or cannula. Okay. We have a lot, remember that there are a lot of nasogastric tubes. The difference between them is that one of them are single lumen,
This is
double lumen, one are made of plastic, some are made of rubber. Some have
Nasogastric tubes.
a radio opaque guide wire, not guide wire,
What is the
radio opaque marking if you want, wire that is used for checking the correct placement of the tube.
This is what?
You see the green part is radio opaque, maybe used for checking the correct position.
Oh, okay.
Then there is here. Who did this? This is a IV infusion tubing. This is the term that is used. Tubing. IV tubing. Okay. This is a tube used for
Trachea.
sucking
Oh.
the secretions of the oral pharyngotracheal secretions. It connects to an let's say
Suction?
suction device in the
Okay.
wall, and being handled like this and inserted in some area and covering and releasing from time to time, in order, because sometimes if the suction pressure is too high, it will absorb everything, even the walls of the cavity. Pharyngotracheal suction tube. It is used for the suction of the secretions that are here. In the pharyngeal or tracheal, maybe used, I know, in the ward every day, in critical care unit, or even through the endotracheal tube, or post-operatively, immediately when the patient is awakened from anesthesia. It is very commonly used. Otherwise, the patient, when you remove the endotracheal tube and it is filled with secretion, may aspirate them, resulting in aspiration pneumonia.
משתמשים בזה בבית אבות.
If it doesn't suffocate, yes, from the beginning. Then, again, we have seen this. What is this? And it's again a double lumen. As a gastric tube.
Catheter.
Not catheter.
This is a Foley, yeah,
Or
Foley.
balloon catheter.
Foley balloon catheter.
And balloon urinary catheter. Same as this.
Foley as well, yeah.
Same as this. But not same as this.
This is the something with a K.
This is
Yeah.
first of all a urinary catheter. Its name is Timan,
T-man.
and it was designed for
وين؟
easing the penetration of the
ايه؟
prostate urethra, especially in setting of stenosis of some kind, especially due to the or when its curvature is accentuated when we deal with an adenoma or hyperplasia of the prostate.
توجع من الناس.
And with the same association, the direction of the tip is exactly with this button here on the hub.
Is it like that or okay?
Then,
والله كنت أفكر
What is this?
for females.
For children?
but in the first day we said that this is for Ahmad. Okay, so it is a Nelaton catheter designed for female urethra catheterization. Okay,
يا أحمد شو خرافة.
female urethra has 3-4
They don't need
centimeters.
balloons. They don't need balloons to fixate, right?
No,
The idea is this. What is the purpose? If you want just to empty the bladder, there is no need to use a self-retaining a balloon catheter.
No. If patient has hematuria, couldn't pee, or there is like compressions or something.
Yes.
So like you want to fixate it for a bit.
So whenever you want to let it in place, to make it what is called an indwelling catheter, the one that stays there, you're going to use a balloon catheter.
Which is where?
This one,
Like a Foley?
Foley catheter. If you want just evacuation and that's it, and to make it a short and easier, you can use a Nelaton catheter. Just insert it, sample the urine, very old and damaged catheter. Okay. This is headset tube, and don't forget to look at it. It's a 38 Charrier or Charrier or French,
For what is it?
or a mushroom tube.
You can say what?
I have presented you this with two purposes. Or basically, again, doesn't matter what kind of tube we're discussing.
What's it? The black one?
If you don't pay a little bit, just 1 minute
Sorry,
attention,
I'm
you will
very
not
sorry.
remember. So this is for everybody and for every tube. So whatever tube we address may be used both for, and that is inserted somewhere in an organ, in a cavity, somewhere, may be used both for drainage or for insertion or injection of something. It may be used both for diagnostic or for therapeutic purposes. So don't forget, in, out, diagnostic, therapy. This has to be always in your mind if you want to, and this is thinking, not just what did we discuss? How was the day? No. So let's think. It is a large tube. What can a large tube may be used for? So something like this. I mean, you question.
You called it Petzer?
Petzer.
Yeah.
Petzer.
No, but what is this?
It's written Petzer. That is, it's mushroom, and it is used to make it self-retaining, basically, to prevent its accidental exit from the organ. And it is
Organ?
For example, so how would I take? Maybe used for drainage or for injection of something. Why would you inject something on this catheter, on this tube? And it's a very large bore tube. To feed somebody.
To feed?
Yes, it is used usually nowadays for the surgical gastrostomy. Why did I say surgical? Because gastrostomy may be placed also endoscopically. Basically, endoscopically assisted. Because you need also small incision in the skin, but you don't have to enter the peritoneal cavity in order to place the catheter. A surgical procedure involves opening, finding the stomach. What is this? Basically is this. If you want to differentiate it from that one, this one. So this is one, and this is the other one. These are basically the position. This is an endotracheal tube, and this is a tracheostomy tube.
Tracheostomy?
Endotracheal tube is through the mouth or through the nose, making it an orotracheal tube or a nasotracheal tube, and this one is inserted through the trachea,
Okay.
but not through the cricothyroid membrane, because it's too large. Those tracheostomy tubes used during cricothyroidotomy that we have discussed last on call, they are much smaller, are, let's say, this caliber, or maybe a little bit larger, because the membrane itself doesn't have this surface. Okay?
So for this, what
Tracheostomy tube. Whenever the natural route is not, is compromised somehow, it is not good to be followed, or maybe after very long-standing endotracheal intubation that will associate pressure injuries on the endolarynx.
And what is this for?
All the tubes inserted into the airways
Have to be
needs
inflated, yeah.
some kind of device, not necessarily for
Get
fixation,
another information from you.
for sealing, to separate wells. But one is fixation, one is sealing.